Hello and welcome to Unstress. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I'm recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present and emerging. Well, our focus today is on managing company health, why the health of your workforce matters, managing change within an organisation, and working at the highest level of corporate Australia and what you do with those skills once you leave the corporate world. My guest today is Marvin Weinman. Marvin has been Managing Director of companies that you would recognise. Probably in your house right now are building materials from the company Marvin was Managing Director of, Boral Building Products, with a turnover of about $1.2 billion a year. Another company that he was managing director of is George Weston Foods, with a turnover of $1.6 billion a year. So he's been involved in some very big companies. And he was responsible, George Weston Foods was responsible for producing many familiar, in fact, iconic brands you would certainly be familiar with in the middle aisles of the supermarket. Marvin's track record of driving major change and improvement programs and his senior executive experience gives us a unique insight and a unique perspective. Now, once he left the corporate world, he also decided to develop a strong community interest. He's a former director of the Garvan Research Foundation and a former chairman of Transplant Australia. He is also founder and chairman of Outcomes Australia. Now, the Outcomes model was developed on the basis that existing successful solutions to commonly occurring global problems can be identified and then used in Australia. Rather than reinventing the wheel, find out what's best and bring it to this country and make it work. He's also chairman of Sharelife. Now, Sharelife was established to ensure that Australians have the same access to organ transplantations as the citizens of the world's leading countries. It's rather sobering to learn that Australians are dying simply because there are not enough organs from deceased organs available for transplantation. I think you would be quite shocked, and we will have a survey at the end of this podcast, which I'd encourage you to have a look at. You may have ticked the box that you're an organ donor, but you're really not. You've just made yourself available. The story is a little more disturbing than that. So we cover quite a range of topics. I hope you enjoyed this conversation I had with Marvin Weinman. How does health and wellness of your employees impact on a CEO? How do you approach that in a company?
Okay. Health and wellness is a critical financial matter. It's also an issue of employees' welfare and so on. But on the question of financial impact, if you're having a lot of accidents in your factories, guess what? Your premiums go up, and that affects your bottom line. It's the same if your factories are down a lot. You will then experience substantial premiums and loss of shareholder value and profits and so on. So the object of the exercise is to be able to institute very strong prevention strategies on both occ health and safety, on maintenance in factories. They're just two examples of where a company has a commercial interest in ensuring that there are effective preventative measures in place.
I know you mentioned premiums as being a major issue, and that was something that I hadn't really thought of. Are insurance premiums for occupational health and safety, workers' comp, a major expense a company has?
Absolutely. It's not just the premiums. It's also, you're also having to pay employees for lost time injuries. And if they're quite serious, you're paying a lot of money over a long period of time. And it's having a significant impact on the employee. And you're also short an employee in a specific role. So you're missing out on expertise, experience, and so on. So there's a whole, everything seems to dovetail around the need for corporates to focus on preventative maintenance, preventive health and safety. We don't want people to get injured. And there's a whole bunch of measures you could use to do that. There's work practices, there's equipment. You don't want to have equipment that exposes people to danger in a factory or in an office for that matter.
Stress is another thing that I think is a major issue for all of us in life, but particularly within the work situation. And I know that you introduced me to the fact that there's a difference between a treatment philosophy and a preventive philosophy. Can you explain that in a corporate sense?
Yeah. Well, again, my experiences are in a corporate area, but I've learned a lot as an individual. And, I'm looking at changes in the community and so on. I've become very sensitive to, sensitized to that. The important thing is that in Australia, if I could give you one example, there's a very heavy focus on treatment. So you fall off the cliff, the health system will treat you, and then they'll put you back on the cliff. Yes. Then a little while later, you fall off the cliff again. So they'll treat you and put you back on the cliff. Then Ron is a very smart guy, and he says, why don't you build a fence so I don't fall off the cliff, right? And this is one of the biggest dilemmas we have in our health system, because as a result of that, or just to give you a measure of our entire health budget, only 2% is on prevention. Okay, that is not a good thing for the community. It's not a good thing for the health system in terms of ensuring that people have sustainable access to the sort of health services that you and I have enjoyed. So I'm thinking about my kids. I'm thinking about my grandchildren.
But this is interesting because you draw the analogy with the health system, and that is definitely true. We have a disease management system. We spend very little on prevention. Are corporations largely reactive or proactive when it comes to engaging with people's health?
Okay, I think I would say that many years ago, they weren't reactive. You could almost think that corporates didn't really worry about the health of their employees. That has changed dramatically because, as I said, there are financial drivers to enhance your prevention strategies. And, people don't like to see, we're community-minded people. So we don't like to see families destroyed by disease or injuries, etc. More recently, you've seen a very good example of this with COVID. Okay, I think the corporate community probably went over the guidelines that the government laid down. People worked at home. People who came in were forced to wear masks. And even today, the practices in corporate have changed as a result of the pandemic. People are still working from home, and there's been an incredible increase in the awareness by both the corporate and the employees about the need to be careful, to take preventative measures rather than waiting till you got COVID so you could go to a hospital. It's both a community-driven thing, and after all, the people running corporations are also members of the community.
Yeah, with families, with their own health issues,
absolutely.
So this is a win. Being proactive, being preventative in your approach is a win-win, not just for the individuals at all levels, but for the corporation as well.
Yeah, and I found it interesting when I read your book about stress-free living, if you like. And when I thought about it, the experiences I've had with change is probably the most significant factor in driving stress. And, just as there are preventative things you do in regard to health and so on, the way in which you manage change is a major factor in minimizing stress.
You drew the distinction between improvement and change, and I wondered if you could just share with us about that.
Okay. I think I should tell you at the start, I'm not a genius, and I didn't learn about change in textbooks and so on. It's when you have to manage, I'm not very good at personal change. I need to lose weight, and I need some support in doing that.
Mm-hmm.
But when you're trying to manage 8,500 people in a change program, you start to really understand what it is that drives it. And as you've noted, I've been managing director of 3 corporations, and they're all in completely different industries. One was decorative surfaces, one was bricks and pavers, and our customer base were builders. And the third one was completely out of left field. It was George Weston Foods, which is a consumer branded product business. We had the #1 food brand in Australia at the time, which was Tip Top Bread. Coca-Cola was the #1 beverage brand. So, that when you're looking at transition and change, even as a managing director, you have to go in with certain learnings and certain knowledge about how to drive change in a way that minimizes stress of the employees and so on. When you talk about improvement, you find a lot of organizations, whether they're businesses or charitable organizations, are doing very well. And when you're doing very well, you actually don't want a major change program. As long as your shareholders are happy, and in the community, your shareholders are the community. In a business, they're the people who invest in your company. Yep. And so you would tend to bring in people you have people running the business who maintain stability and do enhancements of the status quo. Small changes, settle them in, change again. But when you have a shareholder revolution because the returns are unacceptable, then you need change. And the practices in change are so different, because what's important is you can keep improving, but your competitive advantage might be deteriorating because your competitors are changing much quicker, much more significantly. It might be bringing new technologies. You've got old equipment and so on. So even though you're improving, you're going out of business. So that's when corporates and shareholders demand change. Mm-hmm. Now, what's interesting is that the business community learned this about 30 or 40 years ago, because they started to understand we had a lot of corporate takeovers and so on. They started to really understand that if you wanted change, you had to break away from the status quo. So you couldn't do it with the people who were in the company that were beholden to each other, beholden to past practices, because you wanted to change that. So you had to bring in people from outside. And that has been a major success factors for those businesses that have gone through a major transition. It also explains why I was recruited to run 3 completely different businesses.
Yeah, you started with Laminex, which was taken over by ACI, and then you went to Boral, as you said, a building company. I mean, they had $1 billion plus sales, and then George Weston Foods, which I think are major manufacturers of processed foods, but I'm not going to hold that against you. But interestingly, $1.8 billion worth of sales there. I mean, these were all big companies. And how effective is change management in that corporate setting?
Well, let me kind of describe to you what you're walking into when you come into a completely different industry and you're taking over a company that has to change and has to change quickly. So generally, when I was appointed to these roles, they made an announcement. We are trying to do 15 years of change in 5. We're 2 years into it. And so we've brought in Marvin Weinman because he's got a successful record of change. And I always say to people, on my first morning in the new business, how many people do you think greeted me with a hug?
Yep.
And you can imagine there wasn't anybody.
Yep.
Except for probably my new PA.
Okay, that would have been a given. That's a given.
Right. So that's where you're starting. And you then have to deal with people who have been in roles for a long time, and they don't want to disrupt their power base, the way in which they run their business, the loyalty of their management, and so on. So you can imagine walking into, let's say, George Weston Foods and going to visit the guy who's run the bakery in Sydney for 20 years. And the immediate reaction you're going to get is like, I've come from Boral. Like, what do you know about baking bread?
Mm-hmm.
And, my answer was fundamentally, not very much. But if we don't get the performance up, then there's going to be severe consequences, and the changes that would impact you and the employees are not desirable. They will cause enormous stress and so on. So you got to try and get people to be comfortable with change. And to do that, they have to understand that there are certain principles and that doing nothing is not an option. Okay? And I had to learn how to do this on the fly because you're dealing with a lot of different employees, different people with different agendas. And so you kind of work through how to change the groups, and it starts with trying to change people at the top level.
But you also mentioned, buy-in. You made your presence felt at the shop floor, literally, didn't you?
Well, that's a very good point. I think that is the key. One of the lessons I learned early on is most CEOs will bring in their management team and say, okay, this is what we have to do. And because most initiatives are going to come from head office, if you like, in a change situation. And they then think, okay, my job's done. I've spoken to my senior management. They get it, and so on. The point is, at that point in the process, there's been zero shareholder value created. The shareholder value only gets created when there are changes at the coalface, the factory workers, the sales reps. It's only when they change. And so essentially, what you were relying on is that your management team, who weren't really hot to trot about change in the first place, are going to actually drive a change agenda in a proper way with their employees. So I found that it wasn't enough to just get your management team on side, but I developed certain techniques for actually getting right down to the factory floor, getting them to understand who we are, what we're going to do, and the predictability is what minimizes some of the stress. And you want to try and create an environment which is stress-free as much as possible. You do that with your patients. I can speak from personal experience. Okay. It's no different when you're dealing with, a bunch of employees.
Yeah.
If I could maybe just tell you one little story.
Yes, please.
So when I arrived at George Weston Foods, first morning I had to sign documents as a director and so on. And then I hadn't met anybody except for my PA when I walked in. So I called up one of the divisions. We had 10 divisions. One was bread, one was biscuits. Probably ate a lot of our wagon wheels in those days. One was Don Small Goods. So I called up the biscuit general manager who I hadn't met yet. And I said, can you do me a favor? Can you send one of your sales reps into head office? Because I'm the new MD, a sales rep arrived, and she was this young lady, and she came and she'd never met a managing director in her life. And so when she came into my office, and she was probably full of stress, let me tell you, I then said to her, picked up my jacket. I said, okay, I'm coming out on the road with you for the day, and I'm going to make all your sales calls with you. I want to learn what you actually do. And so we went and made calls on Woolworths and Coles and her other clients. And each time I would say to the manager of the supermarket, it's my first day as MD. I'm here with so-and-so. You have to give her a bigger order than normal.
It's a tough sales
joke. Yeah. Anyhow, and throughout the day in the car, I kept talking to her about why I'm there, why we need to change, how we're going to be better off if we do change, how we're going to be worse off if we don't change. And then at about 5 o'clock, she dropped me back at head office, and off she went. And the first question I would ask you is, what do you think she did when she got back into her car? She got on the phone, and the telegraph went to work. Okay. But now they were hearing it directly from me. There was nobody editing what I was saying. So that's a little, call it a trick or a initiative that I used.
But it's buy-in at the ground level. It's connecting and actually identifying what people who you are in charge of are actually doing.
Yeah.
It's understanding them.
It's understanding them, but the key thing is they have to understand the consequences or the benefits of participating in change and what it actually means. There are certain cultural things that have to be, sometimes you walk into a autocratic driven organization. That doesn't work with change. You need to get everybody's buy-in. And so it sounds strange to you, but it's a more democratic process that's needed, it's not you will change or else. Although I have to tell you, through my career, I coined a particular phrase at the end of it. I said, if you can't change the people, change the people. So because I was I'm very much a people's person, I probably went over the line on trying to change people. But sometimes they just weren't going to change for a whole range of reasons. And when that happens, then you have to change the people.
People are changing their jobs a lot now, aren't they? I mean, that's a big deal. What's going on there? Why? What are they doing?
Okay, well, I've now become very interested in that whole space, and I've been working with some leading researchers and academics in the US at Harvard, USC, and my own observations, if you like. And fundamentally, what's happened is the world around us is changing, and it's changing quickly. I remember when I graduated from university, and I'm 74, so it was a long time ago. People, if you got an accounting degree, for example, you then got a job as an accountant in an accounting firm or in a corporate, and you were in the same job for 35 years. Then you got a gold watch, and you retired. And the interesting thing is the only management tool change that you had to make was to go from a calculator to a PC. But the PC was loaded with software. So fundamentally, all you were doing, instead of punching a calculator, you were punching a keyboard. So, it was a very stable kind of thing. And probably people were a lot less stressed and so on. Today, things are changing so quickly. The management tools are changing. I would really struggle to run a company now, given all the technology that's around, all the digital stuff. And so you're kind of in a situation where you have to continuously develop yourself. In my early part of my generation, people got a university degree And that's all they needed for the rest of their career. That was their platform. Today, by the time you finish your degree, already the management tools have changed. And you're seeing an impact of this. You're seeing the fact that people are changing, young people particularly, are changing jobs every 2 or 3 years. In my day, I remember when I was recruited by Boral, one of the reasons, apart from saying I'd had a good change management record, they said, oh, Marvin's been with one company for 20 years. Now, if they say that about you, you can forget about getting another job because you're not actually bolting on new skills, new capabilities, which is what companies don't want just an accountant. They want somebody who's going to contribute in different ways to their business. So what's happening when people leave university, they can only develop by changing jobs, if you like. And so somebody who works for a manufacturing company says, okay, I'm going to get a job with Facebook 3 years later. And they just keep bolting on new experiences and they develop a much more suitable background to that which corporates need. Now, the consequences of that. Now, that's the positive. The impact of that is very interesting because what happens is because people who are today, say 50, they have become to a large extent redundant because they cannot develop at the pace that people are below them are developing. And so they just don't have all the skills to do the job at a higher level than they have in the past. And so I can tell you an interesting story. I was speaking to a professor emeritus at University of California who's an expert on burnout. And so she says to me, I'll tell you an interesting story, Marvin. I was speaking to a CEO of a company and he said, burnout's not necessarily a bad thing. Why is that? Because it allows corporates to cull employees. Not because in the old days, there were people who got fired or retrenched or whatever, because they were either lazy or they didn't work hard. They didn't put in the hours, if you like. Today, that's not the case. Today, it's because they just haven't been able to develop at the same pace as others beneath them. And so corporates are saying, well, if our goal is to optimize the returns to shareholders, then we need to have people who are at the peak of using all the management tools available to achieve that goal. And so what happens is when people stop doing that, then there's a productivity issue. And so what corporates have been doing is they send employees who've been with the company for a while, who've kind of hit that snag, and they send them into what's called outplacement. And outplacement, the company funds it, and basically you get an office, so you're not in the corporation, and people help you with your CV and so on. But that is not helping people with the emotional change. They've lost relevance, they've lost belonging. And also, it has a major impact on friendship because every time you change jobs, you build up a new group of friends. You still have some of your social friends, but now you have a new. But if you're changing jobs 4 or 5 times and usually changing locations, there's a major impact. And people need that social interaction, if you like. So it's a real problem now. And as I said, I've been working with these people, and we're actually looking at a medicine, if you like, that will assist people to cope with the transition into the next phase of their life.
We're not talking about a pharmaceutical product here.
No.
We're talking about a process of, a preventive, rather than just coming in, being proactive about this stage in a person's life.
Right. It's giving people a tool to deal with this transition. Because when you actually think about it, today we are living longer and younger than my father's generation. When he was 65, that was like time to go into the departure lounge kind of thing. And, look after the grandkids, watch Netflix or whatever, and then die. I'm 74. And my son keeps telling me I'm not acting my age because,
Well, you're an interesting example and actually a good case history of this because, having been in such senior positions in such big companies and then coming to the end of that part of your career poses some real challenges, but also some real opportunities. Can you share with us what your own experience has been?
Well, I've been really lucky because my wife, when I was 54, my wife told me that if I didn't retire by the age of 55, I'd be dead.
Okay.
So that was pretty strong. She's probably right. I would have been. So I did retire and I decided to do some things in private equity, do a little bit of community work and play a lot of golf.
Okay.
And then through a set of circumstances, I got involved with an organization that we then founded called Outcomes Australia. And what was interesting is, as I said earlier, what happens to people, it's happening at a younger and younger age. People are so-called retiring, or I refer to as going into the after work phase of your life. People have the illness, if you like, the disease. And I can tell you from all the work I've done, this disease is massive. You think COVID was big? There's 30 million people in the US on psychotropic drugs, okay? And it's happening earlier and earlier. And what happens is three things. They lose their relevance, they lose their sense of belonging, and I've forgotten the third thing.
Those two are pretty major.
Yeah.
Those two are pretty major.
And you have then the threat of loneliness coming in, because how are you going to make new friends? You're no longer in a work environment. And environments are what are conducive to establishing social interaction. I can actually recall a few weeks ago, we were in Melbourne, which is where I came from, after I came from Canada. But we went out to dinner with all the friends we'd had during our time in Melbourne. And I looked around the tables and I noted that without exception, every one of them were friends that my wife made through play groups.
Right. Yes.
Because when you think about it, that's a common interest thing. And so people were going to play groups, and then they said, let's go out to dinner. I'll bring my husband along, etc. And
you've all got kids of a similar age, and it brings families together.
Exactly. So that's an event in your life where you can reinvent yourself easily. It's provided for by the community. School was another one where you reinvented yourself. So now we've gone into this thing that society has never experienced before. Living longer, younger. So when you think about it, between 50 or 55 and 80 today should be the time of your life. Your kids off your hands. And it's a matter of how to maintain your relevance, how to not, drift into loneliness, drift into the departure lounge too early. I will probably go to the departure lounge after I'm 80, which is fine. Excuse me. But the important thing then, if you identify that as the problem, then the solution means that you have to actually reinvent yourself. Just like you did between school and your middle years, when your parents said to you, Ron, now that you finish university, now it's time to become responsible. And it became married, house, kids, patients, etc. Right?
Yeah.
So one thing I forgot to mention, which is implied in change, is it's important for people to want to change. And there are things you can do to encourage them, but they also have to be provided with tools. if you think about smoking, we've had a dramatic reduction in smoking. And it was because of, societal pressures, but we also had patches, we had tablets, we had hypnosis, and so on.
Plain packaging.
Right,
Didn't
plain
help
packaging and horrific pictures on those,
Yes.
which was a constant reminder. So, when you actually look at where we're at now as a society and as individuals who are, say, 50 and above, we actually also need tools. And that's one of the things I've been working on with people. And I would encourage any of your listeners, if they want to know more, we've got a website. It's called Afterwork, one word, .live, live, L-I-V-E.
Right.
Okay.
Yep.
And if you register with that website, you will get access to a quiz, which will open up your mind to some of the things I've been talking about. And, it will afford you the opportunity to go on this journey. The unfortunate thing is that this is one of the few areas where people cannot learn from their parents because their parents never experienced this.
Yeah. Yeah, the precedent it's unprecedented where we're at. And you mentioned, well, you're talking about burnout, and I know they're talking about the Great Resignation as one thing that the last 2 years has done is it's forced people to reflect. I mean, the fact that they haven't had to commute, they realise what a price that pays. The fact that they were working till all hours is another price they paid. So burnout has become a major issue for not just 55 or 50 plus, but for everybody of every age. I mean, your this Afterwork.live, .live is what are some of the things that people, if they were looking to that, what would they find there?
I'd like them to
go in. Okay.
Go in,
but I think maybe
and then they will become, if you like, they will be communicated to on an ongoing basis that will take them into where the solutions lie.
Okay. But in your own particular case, you've got very involved. In fact, Outcomes Australia is a very big part of your life since you've, in your retirement, after work, can you tell us a bit about Outcomes Australia?
Yeah, well, Outcomes Australia is very unusual. I wish I could tell you that I woke up one morning and I thought, there's a better way. And the problem we have is that the community has actually lost confidence in the government's ability to deliver. What Outcomes Australia does is look at, we only get involved in projects where the community's missing out. How do you know the community's missing out? Because somebody else is getting something we're not. And so therefore, we're not in the business of trying to develop solutions because we have 26 million experts in this country. And that doesn't really work. And so what we do is we look at proven leading practice, which has measurement and all that. And then we do due diligence on it, look at its replicability in Australia because we have different laws and so on. And what we effectively do to do that is leverage expertise. And the best way to solve problems, again, to move from the status quo, is not to do with the people who have had stewardship through the status quo. That's why, I'm working with you on things. And we don't actually have any members. We don't have any hierarchy. But where we need certain expertise to look at something, we get it. And we basically form commando units, if you like. And they go and get things done. We don't have administrative tasks. We don't raise money. We just go and find proven leading resources and then go and get it funded.
I know one of the things that Outcomes Australia has been, and you are very passionate about, is organ transplantation, organ transplant. And you have shared with me some statistics. Well, I've done a quiz, and we will have a link to this quiz in the show notes here. But it shocked me, and this is a really good example of not reinventing the wheel, but finding best practice and trying to introduce us. Can you tell us a little bit about Sharelife?
Well, Sharelife went and did exactly what I said. We identified the countries. We, at the time, had organ donation rate. And I should say most people don't know much about organ donation or transplants.
I mean, I've ticked the box on my license and I thought that was it.
No.
My organs are guaranteed to end up somewhere useful.
Yeah, and you assume the system is working.
Absolutely.
Okay, well, that's not the case
Okay.
at all. And the community is grossly misinformed, misled, which poses a serious question about integrity.
Not integrity of the people who have ticked the box.
No, it's the integrity of the people
who are delivering the organs.
That's right. Who are actually supposed to be doing the leading practice system, but aren't really doing it. So when we got involved, we had 9 donors per million people in Australia. When you do a transplant, depending on the organ, the success rate is 90 to 95%. When you think about it, there's very few medical interventions with that success rate. And I don't have to tell you what an impact it has on your lifestyle. Being on dialysis is terrible.
Yeah.
And I used to go and visit dialysis centers every Saturday morning to see the people because it kept my anger level up.
Because you're talking about kidney dialysis. And from my understanding, correct me if I'm wrong, well, what is a typical week in the life of a person on kidney dialysis look like? Well,
you have to dialyze for 5 or 6 hours 3 times a week.
Wow.
When you can get access to a dialysis machine.
Wow.
And what it means is it's very difficult to go for a holiday because if you want to go up to the Gold Coast or something, you got to get access to a dialysis machine. And they're pretty much used all the time. If you're lucky, you might get access between 2 in the morning and 7 in the morning.
Wow.
If you like.
So they're going 24/7?
Yeah, 24/7.
And do you have the statistic about how many people in Australia are on dialysis? I mean, thousands.
I do. Just to give you an example, and I really would like to speak to you at greater length about that. But just to give you 2 examples. In Australia, there are 14,500 people on dialysis. And that's going up because diabetes is going up, biggest cause of kidney failure, etc. Now, of the 14,500, how many do you think are on a waiting list? Most people, I ask that question, you know the answer, so.
Go on, tell us.
But most people say all of them because that's what you would think.
Yeah.
In fact, there's only 1,000.
Really?
So it's about 8%.
Oh, I mean.
In 1999, we were at 26% of people on dialysis being on a waiting list.
Right.
We're ranked 39th in the world on people on dialysis being on a waiting list as a proportion. So, that's one thing. I don't want to, I'll give you one other one that is my favorite way to engage people. We have, and it'll refer to your question about registration. So in Australia, we have about 165,000 people who die every year from all causes, road accidents, heart attacks, cancer. And 8.5 million Australians have registered to donate.
Right. So that is sort of a third of the population have donated. So a third
they're registered.
They're registered to donate. They haven't donated. But of the 160,000, you would think a third of those would be potential donors.
So 40,000 or something.
Yeah.
The answer is this year was about 430 people donated. Now, when you think about that and you realize that we have 8.5 million people registered, people like you, and only 400 or so. And the government is telling people to speak to their family and register. Registration has not driven organ donation. You don't have to be a rocket scientist to work that out. But anyhow, we should talk some more about that.
We will. Coming back to the corporate, because I know that you've come into companies to affect change, and when there's a crisis on, I mean, that's when change occurs. I mean, it is in health. Someone gets a diagnosis of cancer, or out in the bush, there's a fire, or there's a drought, or there's a flood, and a crisis occurs and people change. How do you manage organisational change during a crisis in a corporation? Coming back to the corporate world.
Okay, well, first of all, you're starting off with everybody, the organization's in a status quo mode. You're coming in to change the status quo. In the process of changing it, a crisis erupts. And what companies are doing now is really planning for crisis, if you like. And so I remember in my day, we used to always have what I called a disaster plan. What happens if this happens? So that you can respond very quickly. And sometimes you can actually put in some preventative measures. You don't want to have a crisis. That's the moral of the story. And so when a crisis happens, the first thing is to keep, the more people have thought about what happens in different sorts of crises, the more easily and less stressed they will be in managing it. And you can learn a lot about this from the armed forces, for example. The worst thing that could happen is when people just go haywire and lose it and so on. So that's where leadership is very important. It's a matter of stabilizing. I liken it to an ICU, for example. When you have a very serious piece of surgery, you go into the ICU, and their job is to keep you in the game and then get you back to see your cardiologist or lung specialist or whatever.
But this would come back to where we started this conversation with the difference between a treatment philosophy and a preventive philosophy, because I'm guessing one really important part of the corporation is to build resilience into it.
Absolutely. It's sustainability, it's resilience, predictability. It's when I always used to say to people, I don't like surprises. I don't like bad surprises, and I also don't like good surprises, because a good surprise tells me you're not on top of what's happening. And that's a concern to me, if you like. So again, I think we all do this in our homes. I mean, I don't know if that thing up there is a smoke alarm. Okay. The fact that I have smoke alarms in the accommodation I'm in gives me some comfort. It's a preventative measure. I also know that, for example, I had an accident about 15 years ago, and I had a cerebral hematoma, and I lost my sense of smell. Okay. So I've now worked out preventative measures with my wife, because if we had a fire, I wouldn't smell the smoke. Okay. Equally, if things are past their use-by date in our fridge, I won't be able to detect it unless I look at every label. So I've allocated that responsibility to my wife. And on the smoke, I've got smoke alarms all over the place.
Yeah. Listen, taking a step back, this final question, taking a step back from, your role as a CEO, as a managing director in all these big companies, now your work with Outcomes Australia, because we're all individuals on a health journey through life in this modern world. What do you think the biggest challenge is for people on that journey?
The biggest challenge is to become adaptable to change, because when you go through your life, and people are really experienced at this, they just don't realize it. When the first stage in your life is childhood and adolescence, and there's certain factors that drive or that dictate the criteria for success. Do you have a girlfriend, boyfriend? How do you go academic, or a captain of the cricket team or whatever? And then you move into the middle years. Now the criteria change and you have to reinvent yourself. You have to go from the university or high school or public school, whatever lifestyle. Now you've got all these other responsibilities. It's a major, you want to talk about change? Marriage, children, house, job, it's all hitting together. And that's something a life less stressed is probably a useful thing to read. I know it's made, even though I've had a lot of experience with change, there's certain little tips in here that have enhanced my knowledge. But then you go into what I call the golden years. Mm-hmm. And the golden years used to last for 1 or 2 years. And then you went into the departure lounge. Today, the golden years are lasting for 25 years. That has a major impact on the economy and your own personal financial situation. Because when you're in the golden years, you spend money. When you're in the departure lounge, you don't spend money. And, that's where people in the previous generation said, I wanted to maintain my assets so I can leave it to my kids. Now I have to last for 25 years. And there's a lot of things I want to do that cost money. But I can also do things that don't cost a lot of money, but that are keeping me active, if you like, and keeping me socially active. So, I would say that reinventing yourself is something we do all our lives. It's when you have kids. I talked about play groups earlier and so on. Jobs. Now you're having to reinvent yourself constantly while you're working. Whereas before you could be an accountant for 35 years. So the skill is there, but it's when you go into the twilight zone that people then say, how do I reinvent myself? The other phases are predictable. You can look around you. Here, this is new. You with me? People haven't had to deal with this. The environment's changed. We're living in a different world. And, I think one of the things I'm doing with these other people in Afterwork is to actually provide people with tools. First of all, they have to realize what their disease is. I know working with researchers, for example, they will provide very strong evidence on symptoms, depression, suicides, drugs, alcohol, etc. Those are symptoms. And what do people do? They go into therapy. If you think about it, therapy just keeps you going from week to week. It's not solving your problem, right? Or medication, anti-stress or antidepressants and so on. So I think what I've learned is that I'm very interested in this whole area because it's new and it's different. And it's getting people to understand their disease. It's getting them to understand the diagnosis. It's what you do whenever I come to see you, right? If you get your diagnosis wrong, your treatment's going to be wrong. So, I would encourage people because it's a journey we're all going on and the answers will evolve and so on to, as I said before, go and register with Afterwork.live or live.
Yeah. Marvin, thank you so much for joining us today. And we will have links to Afterwork.live.
Yeah.
Live.
Yeah.
Yeah. Thank you. Well, as I mentioned, Sharelife, the organ transplant story in Australia is actually a rather sobering one. And I will have links to that site, and you should really go in and fill out a questionnaire because one day you or one of your loved ones may be looking and needing an organ transplant, and they are incredibly successful. I mean, the success rate is something like 90%, certainly when we're talking about kidney transplants. And yet we have 8 million potential donors that have ticked the box, and yet you may be surprised to learn how many organ donations there actually do occur. Remembering, if there are 8 million donors, and really the sobering statistic is that 160,000 odd people die every year in Australia, you would think, well, there would be a lot of potential donors there, so there must be thousands of organ donations going on all the time. Well, fill out this questionnaire. You might be surprised and shocked. Anyway, I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.